to introduce Ontario Green leader, Mike Schreiner.
Bonjour tout le monde. Good morning, everyone, and thank you for joining today's virtual announcement. I'm speaking to you from the traditional lands in Treaty 13 lands of the Mississaugas of the Credit First Nation. And I just want to reaffirm the Ontario Green Party's commitment to the truth and reconciliation process. Everything is not okay when it comes to children's mental health. There are over 28,000 children and youth on wait lists to access mental health care, and wait times can reach up to 2.5 years. And unfortunately, the pandemic has only made things worse. The impact of COVID has been hard on kids. Social isolation from not being able to see friends in person, and the loss of extracurricular activities. The anxiety and uncertainty of the constant back and forth between online and in-person learning. The disruption of daily routines, and much more. According to Sick Kids, over 70% of school-aged children reported worsened mental health during the initial COVID-19 lockdowns. And here's the bottom line. Mental health is health, and help should be available when and where kids need it, not months or even years down the road. And that's why today I'm announcing the Ontario Greens Children and Youth Mental Health Strategy, which will reduce children and youth mental health wait list times to 30 days or less by hiring more frontline workers, ensuring students can seamlessly connect to community health professionals that are located at or near schools, investing in youth wellness hubs province-wide as a one-stop shop for employment, health, education, recreation, connection with friends, and housing support. Our goal is to have at least one youth wellness hub in every community across Ontario, and ensure that mental health, wellness, and resiliency training is included across the entire education system, including implementing a comprehensive curriculum that covers issues such as mental wellness, coping skills, and stress management. People in Ontario want mental health care to be accessible, affordable, and available in a timely manner. And the Ontario Greens are ready to provide the leadership to make it happen. I'd now like to introduce Ontario Greens education critic and our candidate for Parry Sound Muskoka, Matt Richter. Welcome, Matt, and thanks for joining us this morning.
Well, thank you, Mike, and welcome and good morning, everyone. As a teacher, as the Ontario Green education critic, and a father of three, I see the toll that the past 2 years has taken on the mental health of our children. Significant gaps in development among the students is more pronounced now than ever before. I think it's important to first remind ourselves that the last time any student in Ontario had a typical year was 3 years ago. You know, when I consider my youngest son, who is in grade 5, that makes grade 2 the last uninterrupted year of learning for him. At the elementary school level, I, along with all education staff, have witnessed a significant change in the number of students who struggle to cope with typical day-to-day challenges of being a student. Completing a given task, working with others, sharing materials and equipment lead many students to heightened levels of frustration and anger, resulting in shutting down and acting out. Now, obviously, these challenges existed pre-pandemic, but the increased frequency and intensity that teachers are reporting is more problematic. More students at a younger age are also sharing that they're depressed, anxious. They're sharing ways of harming themselves and describing ways of attempting suicide. This is devastating. You know, unfortunately, when students are experiencing a mental health crisis, they cannot access the support they need. And during this pandemic, the disruption in learning with COVID-19 protocols and transitions between online and in-school learning broaden the already existing gaps among students and their peers in academic learning, social development, physical fitness and skills, and real-life experiences beyond their communities. Negative self-perception, depression, and anxiety resulted. Many students' stress levels increased as they didn't have consistent access to technology. They had additional demands at home to be a caregiver for younger siblings, and they were reporting ongoing feelings of loneliness. Add to all this the demand from the government to continue with the EQAO standardized test, as if it's business as usual, is simply irresponsible. The EQAO test is already a source of stress and anxiety, and yet the government wants a student in grade 3 that did not experience a typical uninterrupted year since kindergarten to prioritize that. As a father, a teacher, and an education critic, and on behalf of everyone in Ontario, I need to reiterate the message that mental health is health, and our actions and priorities must be focused on ensuring our children feel safe, loved, and approach their day with confidence and enthusiasm. Thank you for having the time to share and have this opportunity to do that.
Thank you, Matt, and thanks for your great work, both as an educator and as a candidate in the upcoming election.
Thank you.